The article I chose for my review was a controlled evaluation of acceptance and commitment therapy plus habit reversal for trichotillomania. This was conducted by Woods, Wetterneck, and Flessner at the University of Wisconsin-Milwaukee. Some definitions and key concepts. Trichotillomania is defined by the repetitive pulling of one's own hair resulting in notable hair loss and significant life impairment. Prevalence estimates are at 6% of the population and is way more common in females. Limited research on trichotillomania suggests that two separate processes are involved here. One is the dysregulated habitual motor pattern, and the second is a coping mechanism for dealing with private events. ACT and habit reversal training. Habit reversal training, or HRT, is an evidence-based behavior therapy used in the treatment of body-focused impulse control disorders. It involves different components such as self-monitoring, awareness training, stimulus control, and competing response training. Acceptance and commitment therapy is an empirically based psychological intervention that uses acceptance and mindfulness strategies together with commitment and behavior change strategies to increase psychological flexibility. The purpose of the current study consisted of an intervention comparing of a treatment group, which was 10 sessions of ACT and HRT combined, and a control group, which was a waitlist control for adults with trichotillomania. There were three central hypotheses for the study. The first hypothesis was that the treatment group will show significantly greater reductions in pulling severity scores to the post-treatment condition. The second hypothesis was that the treatment group will experience a significant decrease in experiential avoidance at the post-treatment condition. And the final hypothesis was that reductions in experiential avoidance will be related to hair pulling reduction in those receiving the treatment of ACT and HRT. Participants in group assignments. The total sample consisted of 28 participants, 3 male and 28 female. A random assignment was used to divide the participants. 14 participants were assigned to the ACT HRT group, and the other 14 were put in the waitlist control group. There were 96.4% of the sample were Caucasian, and 3.6% were African American. The mean age of pulling onset was at 12 years of age, with a standard deviation of 3. Materials, measures, and scales. All these measures were used in the current study. The hair pulling measures consisted of the MGH hair pulling scale, the NI-MH trichotillomania impairment scale, and self-monitoring of pulling. Also, the Personality Assessment Inventory, or the PAI, was used for the assessment of comorbid functioning. And the process measures consisted of an assessment created by Hayes, which is the Acceptance and Action Questionnaire. Also, the Modified Treatment Evaluation Inventory short form was used. Also, treatment compliance ratings and treatment utilization forms were used and created by the current author. Procedures. There were 3 central procedures throughout this experiment. First were the pre-treatment tests. Here the participants completed the MGH-HS, the NI-MHTS, the AAQ, and the PAI, as well as the self-monitoring results. The treatment condition followed that and consisted of the treatment group, which participants were given 10 sessions of the combined ACT and HRT across 12 weeks, and the waitlist control group were not offered treatment until the post-treatment session. Following the treatment condition, post-treatment tests were re-administered, and they were just the same battery as the pre-treatment tests. Results. A 2x2 mixed ANOVA was used to evaluate the change in MGH-HS scores from the pre-treatment to post-treatment across groups condition. No main effects were found for the group, however, significant main effects for time and group-by-time interactions. Both of these were found at the p.01 level. Another 2x2 mixed ANOVA was used to evaluate the change in NIMHTS scores from treatment to post-treatment across groups. Here, significant main effects were found for group time and group-by-time interaction. results continued. A final 2x2 mixed ANOVA was used to evaluate the change in mean hair pulls per day from the pre-treatment and post-treatment across groups. No main effects were found for the group or time. However, a significant main effect was found by group by time interaction at the p.01 level. Additionally, a paired samples t-test was conducted to compare post-treatment and follow-up levels on the MGH-HS, the NIM-HTS, and self-report of hair pulls per day. MGH-HS scores at follow-up were significantly higher than those at post-treatment at the p.05 level. No post-treatment to follow-up differences were significant for the NIM-HS, TS, or the average number of hair pulls per day. However, this wasn't significant. Pulling reductions were maintained at the 3-month follow-up. Discussion. The current study contributes to behavioral research by providing randomized control trials, demonstrated the efficacy of a non-pharmacological treatment, and a blind independent evaluator administered all of these treatments. The results confirm the study's hypothesis. The ACT-HRT is more effective in reducing trichotillomania severity than the weightless control. Reductions in experimental avoidance were significantly related to decreases in pulling. Some of the considerations I mentioned from the study were, the first thing was the sample size. Although they were larger than most in the previous research, it was still pretty small, and a generalization can be difficult to determine here. Also, the participants, I noticed majority of the sample consisted of well-educated Caucasian women, so it might be interesting to look at males, other cultures, or even SES status here. Also noted, trichotillomania was not completely eliminated. Although there was clinical significance for participants in the treatment group, trichotillomania still persisted for a lot of the participants. You may want to look into improving treatment efficacy and maintenance. Non-specific factors affecting behavior. So the study cannot rule out the possibility of non-specific factors in affecting behavior change. Maybe placebo-controlled studies should be considered at the next level. The length of treatment was also something I considered. Perhaps extending the duration of treatment might help to get more significant results. This study, again, only consisted of 10 sessions. Also, you may want to booster the sessions after the treatment ends. This could increase the treatment maintenance. And lastly, maybe compare ACT to the ACT and habit reversal training. Useful to compare the differences between these two treatments. And also, ACT consists of 6 components, and it may be interesting to see which of those 6 components may be more effective than the others. So some of the take-home points. This was a pilot study that showed that ACT and habit reversal together was an effective treatment for trichotillomania. The utility of statistic designs. They used very strong statistical designs in this, using two-way ANOVAs, also t-tests. So it did lay grounds for additional research, and a lot of research should be rooted off this study. Thank you.